Randa, can you hear me?
Yeah, please, please go ahead. No, because please go ahead, dear. It started recording.
Okay. Yeah, so hi everyone, and welcome to today's session of this program that we are doing. And I'm sure that Randa has already, introduced you to the session, informed you what we are trying to do, and we really thank you for availing yourself today and attending the session. And we know that you also have many other things to do, but the fact that you also spared some time so that we learn together, that's really amazing. My name is Daniel Arwenge. I'm from Kenya. I work with an organization called ZIHI Institute. It's a research and non-profit organization based in Kenya. So we work mainly in Kenya and other parts of Africa. Yeah, but also we collaborate with different organizations across the world. So today we will be dealing with AMR and SDGs, and the reason why this topic is important, where we saw it as something that is very important to tackle, is because you see most of us, maybe some of us work with civil society organizations, NGOs, and all that. And you find that most of the time, when you're trying to solve a problem or when you're trying to address an issue, you find that most of the time, especially governments or donors and all that, they would want to actually know which SDG are you trying to tackle, and how are you, or your project, how is it furthering sustainable development goals? So you find that in the AMR sector is a very important sector, but at times we are left behind a bit, and the reason for this is sometimes we are not able to. I can see someone else is sharing their screen. Jibril, maybe, I don't know. Randa, are you able to remove that?
Yes, just a moment.
Okay. Yeah, I think it does. Yeah. So then, sorry for that interruption. And what I was saying is that most of the time when you're dealing with AMR, you find that at times you're not able to clearly articulate what SDGs does AMR actually influence. I hope I'm audible, Randa. Maybe if colleagues, you can hear me, you can indicate a thumbs up.
Yes, we can hear you.
Okay.
Please,
so I think
everybody react.
Okay, yeah, so you can just share thumbs up. Thank you. Okay, so I think I can just share a message in the chat. So I think that's an issue of network on that side. So what I was saying is that most of the time when we are talking about AMR, or when we are trying to advocate for AMR, we at times are not able to very clearly articulate what SDG does AMR actually affect, or where does AMR fall in. And you find that sometimes we lose opportunities on this. And as we already, maybe some of us know, we don't have a lot of dedicated funding that is coming to AMR. So that also limits the initiatives that can actually be done in that area. But at the same time, we were able to skillfully relate AMR with SDGs. We can be able to get a lot of buy-in and also get to make it easier for people to understand what AMR is all about. So I know some of us have been in the previous sections and you already know what antimicrobial resistance is and all that. But we'll start by briefly sharing a bit about what is antimicrobial resistance and what is this phenomenon for those of us maybe who have not encountered this before. So AMR is a natural phenomenon. I'll just start by saying that, and it's something that happens naturally, but it's an issue right now because it's actually accelerated by a lot of our human activity and a lot of behaviors that we're actually engaging in the morning. So antimicrobial resistance, or in short what we call AMR, it occurs mostly when bacteria, viruses, fungi, or all microbes and parasites, they change over time and now they stop responding to drugs that they were originally susceptible to, or to drugs that could actually, eliminate them. And you find that this is a natural phenomenon, as I had said, and it happens because just as we humans evolve over time, or we develop innovative ways to continue surviving in this world, is the same thing that all living organisms also do. They also develop ways to improve against some of the threats that they face. And you find that because of that, microbes also try to find innovative ways that they can survive against threats that exist. And some of these drugs that we use, some of these antimicrobials, are already a threat against. They are a threat against these microbes. So they have to find creative ways to actually maneuver through and survive. Otherwise, they will be eliminated. And what happens is that the ones that survive then develop resistance mechanisms. So they become stronger. It's just the way that if humans you evolve, you become stronger. And maybe some of us have heard of the phenomenon of natural selection, whereby some of the weak ones or those that are not able to adapt, they are wiped away, and those that survive become stronger and they produce stronger offsprings. Microbes have offsprings, but in short, what this then happens is because here we are targeting pathogenic microbes. These are microbes that cause diseases. So when you have a case whereby you have microbes that no drug is actually able to, eliminate them. So what happens is that if you have an infection, if that microbe then affects someone and causes an infection, it becomes very hard to treat that infection. It increases the risk of disease spread. As we know, just as we saw in COVID, you can actually transmit. So that resistant bacteria will actually be transmitted from one person to another. And then you have so many, and because it's not being treated, then it actually becomes, it's actually transmitted very, very high because the load is also high. And that is also very dangerous. And it's something that if you don't treat and continue affecting, then it might also cause severe illness and death. So let's not just look at it from a personal perspective, but also look at it from that aspect of disease spread, as we saw with COVID. Imagine you have a scenario where you have a resistant microbe and it's spreading all over and you're not able to actually mitigate it. What does that mean? That means that you're actually facing a very serious situation. So some of these antimicrobials that we use, they include antibacterials, antivirals, antiparasitics, and antifungals. And it's a bit self-explanatory that, antibacterials, they use the counter bacteria, antivirals, viruses, and all that. And apart from them being used to treat infections, you have some procedures that happen in our facilities that actually do require antibiotics. For example, cancer chemotherapy. You find that some of the anti-cancers that we use, they really do destroy the body's immunity. So what happens if the body's immunity is destroyed? Sometimes someone is given antibiotics just to protect them from, getting getting some of these opportunistic infections. Other cases is, for example, HIV. For example, those with a very high viral load or those that are symptomatic. And nowadays is actually standard practice. They're also given some antibiotics just to ensure that even though the immune system is a bit compromised, they're able to, if they're attacked by a serious bug, they have antibiotics in their system that are able to counter these issues. To do with surgery, sometimes before surgery, we give a bit of antibiotics, and also organ replacement. The same case with immunosuppression, because when you're doing organ replacement, you have to suppress the immune system a bit just to prevent sometimes the body can develop antibodies or against this foreign organ and all that, so to prevent all this. So this is just in human, but you find that antibiotics are also used, antimicrobials are also used in animals as they're used in humans, they're also used in plants, and they have many more measures. So we'll reach that introduction for there today, and I'm sure we'll tackle more about that. Now let's focus a bit on the burden of AMR. And when you're talking about the burden, let's look at it from a global view, because today we are so much cosmopolitan. We are from different regions, and it's actually something serious, because we see some statistics that share that if we don't take proper action, AMR could actually lead to 10 million annual deaths by 2050. And 2050 is just 25 years from now. It's not very far away. And currently, you can see that the global burden of AMR every year, the deaths that are being caused was around 1.27 million from us, data that from 2019 data and all that. And you find that apart from this, there's also a lot of economic implications in terms of, additional healthcare costs, because if you're not able to treat you're not able to treat these bugs with the available antimicrobials, then you are forced to purchase others, which are maybe, we call them reserve drugs, which are usually more expensive and sometimes have also very serious side effects. So you find some people cannot afford these. Issues to do with GDP because of reduced productivity also comes in there. And, when people spend so much on healthcare, it also pushes poverty. So that's just a brief introduction to tackle a bit about that. And this is just adding more statistics in terms of these, and just trying to also explain more about the situation. And let's just look at some of the socioeconomic drivers of AMR. So as we said, AMR is a natural phenomenon, but it's mostly driven by some of the behaviors. So you find that some of the drivers, for example, include, sometimes living situations, the housing conditions, they also affect some of these things. Healthcare access. For example, if you're not able to visit a hospital, or for example, if a hospital is very far away, then you'll be forced to, and you have to go to work, you have to go to school and all that. So sometimes you're forced to go just and purchase antibiotics over the counter for the short period. And sometimes because of issues also to do with maybe poverty and all that, you're not able to purchase the full cost. We look at issues such as human mobility, humans traveling all over. As we said, one of the key things is that you see these drug resistant microorganisms can actually spread from one person to another. We have a lot in terms of climate change. There are a lot of issues to do with gender and all this. And also conflict. Conflict is a very serious, as you can see currently in some of the parts of our world, where there's very little healthcare access. You also have a lot of heavy metals because of the shelling and all that. And this also, in a way, also affect the mutations of some of these microorganisms. But most importantly, lack of healthcare access, lack of basic needs, so sanitation becomes an issue, eating balanced diet becomes an issue, issues to do with starvation and all that. And it's very important that, we're able to raise our voices also in the AMR, in places where we actually feel that there's conflict, so that because it has that ripple effect also on things to do with AMR. So let's now delve into the topic. So that was just an introduction. So when now we delve on the topic, we'll start with looking at the aspect of what are these sustainable development goals. And so sustainable development goals, as per United Nations, we actually have 17 sustainable development goals. And these actually form a plan that looks at how can the world become better. We are looking at sustainable development, issues to do with economic development, issues to do with social development, issues to do with environmental development. When we look at economic, the goals focus on how do we promote a sustainable and inclusive economic growth to actually ensure prosperity. With sustainable means that it's something that is, people don't just live good lives for 1 year and then they revert back to, poor conditions and all that. So there's a lot of issues to do with how do we make it sustainable, but also ensure that it's inclusive, also ensuring that if it's economic growth, it's actually holistic growth for everyone. It's not whereby maybe we see certain classes very high margins of growth, but others are actually left behind. So it has to be inclusive. We look at socio, how do we then improve the quality of life that we live, and how do we ensure that there's a lot of social cohesion. We are living in very just societies, resilient societies, that we're able to tackle some of the things that actually befall us. For example, some natural issues that we have very little control of. Such as earthquakes and all those things. When we look at environmental, we look at how do we then protect and manage some of the natural resources and some of our ecosystems, and not, conservation. And we can see this actually becoming very important because of what we're actually seeing with climate change. So these 3 dimensions, they're not addressed alone, but they're addressed, they're all interconnected, and you have to look at them holistically, because the 3 enmesh together what then will help in terms of promoting quality life and well-being of individuals and societies. So we have 17 goals, as we said, and the first goal is no poverty. We have second goal is zero hunger. We have number 3, which is good health and well-being. We have number 4, which is quality education. We have number 5, which is gender equality. We have number 6, which is clean water and sanitation. Number 7, affordable and clean energy. As you can see them in my slides, I won't read all of them. We have 17 goals. But before I go on, I'd just like to maybe hear in the chat from a couple of us, which where do you feel AMR lies in the Sustainable Development Goals? So I'd seen none response, but I think we can just share. Where do we think AMR lies? Just that seconds, we can just share in the chat, please. Thank you. So where from your own understanding, where do you think AMR lies? So let's just type in the chat. Thank you. Yes, thank you. I can see SDG 3, and maybe we can also give some reasons. But I can only see 2 and over 100. So yeah, let's let it be interactive. Please feel free to participate. SDG 3, SDG 6. Thank you so much. I can see one good explanation from Noreen Juma, because it affects our health and well-being. Let's share just a couple more. SDG 3, SDG 3, 4 and 6, also 12. Okay. Maybe some reasons. Anyone else with a reason? Also 12, responsible use of antibiotics. Thank you, Othman. Yeah, I can see. Okay, Muhammad, it's broadcasting and can be linked to various SDGs such as 3, 6, and 13, and more. Thank you. Okay, so I think let's now continue. Thanks so much, everyone, for the. Thanks so much, everyone, for your contribution. So let's just look at it in a brief. So when we look at these sustainable goals, and these are them now here in a bit of explanation. So this was just the main, and we can see this is a more inclusive explanation. And it's important to mention that these SDG goals were actually developed by were actually adopted by all the 193 member states of the UN, including the United States, and this was in September 2015. And as we have said, we've actually explained why they are important. Now let's delve more into when we look at sustainable development. What is the AMR impact on sustainable development? And before we look at the SDGs themselves, let's ask ourselves, how does AMR actually influence or does it actually impact sustainable development? Does AMR actually threaten attainment of these SDGs? And above that, what are some of the implications of having high levels of drug resistance? So raising levels of AMR, one of the things is that, as we said, it makes it hard to treat humans. It makes it very hard to treat animals and also plant. For humans, it's self-explanatory in terms of what happens when humans are not able to recover. But when you look at issues to do with animals, animals is also, when you have so many sick animals and, you have this bug spreading and there's no drug that is working, that now brings in another issue where, especially issues to do with food safety and food security. So you find that one, you're not able to have enough, food because for depending on the different animals that are slaughtered in different places, if they are affected, then it means meat becomes an issue. Maybe I think there's someone who has unmuted. Randa, you can check for me. And then there's also the issue of plants still cuts in there on food security. But also when you look at animals and also plants, you also look at something, especially animals, especially issues to do with zoonotic infections. Zoonotic infections are these infections whereby there's crossover. For example, an animal infections can actually be transmitted from animals to humans and vice versa, and also from humans to animals. So that is also something very important that also needs to be checked on. We look at issues to do with another thing is that when you have when high levels of drug resistance, it then affects global health, because now imagine now a situation like where we had COVID. Now you have this bug that is actually spreading across the world, and there's no cure for it. And you can imagine what happened with COVID, and the backslide that we had as a world, and that is actually kind of similar to what would happen if we have rising levels of AMR. Economic growth, when people are not healthy, they're not able to actually work, and productivity goes down, and that affects economic growth. We find that, as we said, you spend so much on healthcare, and so the key gains that have already been made on poverty alleviation, then that means that can also backslide. Issues to do with the environment also, that can also backslide, because you're also seeing how actually climate health, like AMR can actually, it's nexus with climate. So it also tells us that we could also backslide a bit on this. And so in a nutshell, when we look at mostly SDG 3, is that maybe Randa, you can help me mute.
Yes, I'm checking that.
Okay, thank you. So when we look at AMR, we see that there's one of the things is that SDG 3 is also looking at issues to do with universal health coverage, and you find that these rising levels of drug resistance will actually make it very difficult for us to achieve universal health coverage. And actually, a study from the World Bank actually shows that we could actually see healthcare costs increasing up to 25%, and these costs have to be catered from somewhere. And this is especially in low and middle income countries, and I believe most of us, either from Middle East or Africa or different parts of the world, especially those who are in the call mostly, maybe we are still in maybe low and middle income bracket for now. And because of that, it's very important that knowing that AMR does not just affect humans, and there are implications that don't just affect human health, but also have an effect on animal health and plant health. And it's actually cross-cutting, even to do with issues to do with health security. Then when we are trying to address the issue of sustainable development, or when you're trying to see how to achieve sustainable goals, rather than just look at each goal by itself, it's good that we look at it from a holistic aspect and ask ourselves, especially through an One Health approach. And One Health, for those maybe who might not have interacted with it before, is this collaborative multi-sectoral and transdisciplinary approach that kind of recognizes that we don't exist or we don't live in silos. We have interconnections between people, between animals, between plants, and where we live. Maybe where you live nearby, in a day you might come across an animal and all that. And as you can see in that diagram, is actually very interconnected, whereby you see pharmaceutical compounds from companies. They are effluent. Some of those effluents are thrown into the rivers and all that, and they find fish there. And some of them go to humans, and but then maybe humans don't take those other than antimicrobials well. They interact with animals, or some animals then take this water that has effluents and all that. Some of it is used in the plants for irrigation, and it's actually cyclic, and in a way it finds itself to humans, to animals, and all that. So every time we're thinking about AMR and sustainable development, it's good that we look at it from that holistic aspect. Then let's now look at SDGs and AMR, and we'll actually look at it from a dual context. What I mean by a dual context is that on one side, we look at it from the aspect of you have these rising levels of AMR. How do they make it very difficult to achieve, some of these SDGs? But also on the other side, let's also ask ourselves in terms of how can progress in these in attainment of some of these SDGs actually help in terms of mitigating the spread of AMR? So it's a two-faced coin, and it's also very important we look at it from both aspects, not just how AMR will affect attainment of SDGs, but also it's also good to make a case that maybe trying to attain some of these SDGs will actually counter AMR, and we'll actually see how it actually does that. So that when you're trying to start a project, you can also say, if I'm able to improve access to clean water and sanitation, then in a way, I'm also able to counter AMR, and they're also able to show that linkage. Let's see how, let's start with one of the SDGs, and we'll actually look at no poverty. when you look at poverty, which as we saw, let me just go back. It says that and this goal looks at ending poverty in all its forms everywhere, and that's very self-explanatory. So when you look at AMR and how does it implement this action of ending poverty everywhere? Sorry. And one of the things that we have to first to realize is that people who live in poverty are more prone to some of these infectious diseases. And some of these diseases come as a result of our living conditions, issues to do with foodborne infections, cholera, and all those diseases, and so many others. And the other context is that some of these resistant infections, if they unfortunately come into play, they are more likely to spread in people faster in people living in poor conditions. So in a way, because of that, then you find it's actually like a loop whereby then if people had already started building themselves economically and then they are exposed to this, it then impedes them from progressing forward. And also issues to do with access to effective treatment is also very difficult for people who live in high levels of poverty. We also address issues to do with substandard care, and also, sometimes substandard care, and nowadays in AMR, we don't point fingers. Sometimes some of these things are sometimes very complicated. And it is always good to hear people where they're coming from. For example, I have maybe $10. And let me use that because it's a currency that we cannot maybe relate with. And when I have this 10 USD, and I'm trying to, I have to buy some antibiotics, but also I have to buy some meal for the day and maybe some other basic commodities. And I'm not able to buy the full dose. So it either means that I either buy the full dose and maybe sleep hungry or not able to meet some of the, key requirements, for example, transport to work and all those things. And so sometimes people are forced because of their situation to actually access substandard care, whereby they are told that they go to a facility and they are told, okay, this is the place, but we then have to do a culture or we have to do a full hemogram. And a full hemogram is some of the blood tests that we do. And but they don't have the finances to pay for that. So they opt out of that. And in a way, that leaves a lot of queries to what is being treated. So because of these, you find that that substandard care can also drive high, high infection rates. It's also the cause of, at the end of the day, we also look at it from the aspect of, even maybe someone who was stable because of getting chronic infections that don't heal, or, because it's a resistant bug, you give it this time, this drug does not work. And it affects your productivity, high cost of treatment, you're not able to, and then that impoverishes. But then we look at it on the other side. How can, if we're able to address poverty, or for example, if you're submitted a project somewhere, you're looking at it from the aspect of how can me tackling SDG 1 actually help to address AMR? And you see that sometimes when you're able to input good financial and social protection strategies, when we say financial protection, we're looking at issues to do with, making it easier for people to do business, enabling people to, microfinance services and all those things that can help people maybe get access to quick business loans and all that. And also social protection, giving them good, for those who live in maybe urban informal settlements, a bit of good housing and all that. It can actually will help them access some of these quality services, and it will actually cushion them or protect them from some of these issues to do with infectious diseases. So they will have a good quality of living, and that in a way will also decrease the impact of AMR, as we've seen. So that is SDG 1 on no poverty. Let's look at SDG 2 on zero hunger. And we look at it from the two aspects also. How does AMR impede progress on this zero hunger, or as trying to end hunger in the world? So one of the things that you find that people who live, especially people who live in starvation, sorry, that slide wasn't complete very well. And, when you are hungry, one is that, especially maybe with starvation and all that, your immune system is also very down. So that means that you are really prone to a lot of infections and all that. So because of that, you're not able to, your body is not able to fight some of these infections and all that. And at the same time, we also look at when there's hunger or when there's very little supply of food, what happens is that the food that is available, because demand is high, supply is low, then that also makes the cost of food actually go up. And as a result, many people are not able to access it. But also at the same time, you find that some of the times when we have hunger is when maybe we have, maybe drought and all those, poor climatic conditions. And in a way, that also, affects the cost of production of food, because it becomes very hard to do this. And now when we look at, from the aspect of AMR itself, when you have, as we said, for example, when you have maybe you have a head of cattle and they are affected by a drug resistant bug, and you have tried all antibiotics and none is working. And then, they start, you're not able, if it was dairy cattle, you're not able to milk. If it was meat cattle, you are not able to, take them to the market for meat and all that. And you find that because of that, you then, as a farmer, you end up losing your livelihood. You end up going a lot of, losses and all that. And people who are to consume these products also are not able to. At the same time, there have been studies showing that, for example, livestock production, just because of AMR, will actually be affected and may actually decline to an 11% loss if we find ourselves in that high AMR impact scenario. Same case whereby, you have these bugs that are, spreading everywhere. You don't have the cattle, or, your livestock are actually impoverished. You're spending too much on medicine. They're not able to eat well. You're not able to, produce optimally, and that affects the food chain. And as a result, because there is not much, whatever it remains then becomes very expensive, and it becomes hard for even people to access some of these foods. But then we look at the aspect of now, how can, if we make progress on zero hunger, on the goal of zero hunger, how can we address, how can it help in terms of mitigating AMR? When you look at it from the aspect of when you're able to develop good sustainable food production systems, and this is especially internally with not really very much fluctuations. One is that you're able to have a healthy society in one way. And as a result, this healthy society, you're able to, it cushions people from diseases and all that. So just a minute, Randa, just 30 seconds, please, kindly.
Yes, please go ahead.
Sorry for that interjection. So what I was saying is that if we're able to have very good, a good, healthy, people have food and all that. So that means also the health, people are actually able to, people have good health and all that, because good nutrition and good health also go hand in hand. But also at the same time, you look at, for us to really attain zero hunger, it means that we have to do some things. It means that we have to ensure that, there's good vaccination for animals, there's good biosecurity for animals and all that. We have good professional food for people who can, treat these animals, and also plants, incorporating plants in this. And that means, in a way, because you're also trying to take care take care of these animals and these plants in the best way that you can, it will also have that trickle down effect of reducing that spread of drug resistant infections. Now let's now look at another aspect, and this is the one that maybe it's very very direct. So I won't dwell so much on this, because it's actually very self extra explanatory. We are looking at AMR, good health and well-being. As we said, this is actually the most, this is actually very direct. But just like to have a look at this photo, credits of React, actually took it from the React toolbox. And we can see that antibiotics are the cornerstone of medicine. And this, when we say antibiotics, but also in extension, antimicrobials. And this is because, as we said, we don't just use these in terms of treating infections. We also use them in some of these procedures that we have in our hospitals. It could actually be very difficult to do them without antibiotics. Cancer treatments, as we said, about organ transplants and all that. So in totality, I think this SDG is very evident, so we won't dwell so much on it. Let's go into another one. This is just an addition in terms of when you're able to have accessible health systems, as you have said, a good trained workforce who are able to provide high quality care, when you have well-equipped hospitals that have the key diagnostic capacity that is required, when you have good increased vaccine coverage, which also, protects people from some of these infections and all that, and you're able to have a good healthcare system whereby you're actually able to reduce out of the cost, out of pocket payments, so that people don't spend so much of their money on that end, which also is a very good cushion against poverty and all that. But then let's look at the next SDG, which is clean water and sanitation. So we look at it from a dual aspect, and here we'll actually try to address how does clean water and how does AMR actually impact clean water and sanitation. So one of the things is that some of these effluents that we have, for example, from pharma companies, from farms, whereby we drain all the manure into rivers, and some of this manure has those particulates or has some residues of these antimicrobials. And also you find that how we dispose, even household disposal of some of these antibiotics. So in a way, we end up, having water bodies or water systems that have a lot of high concentrations of these residues of these antimicrobials. And within these water systems, you also have a lot of microbials too, and microbes too, or microorganisms. So, and these are in suboptimal quantities. These are quantities that can't kill them. So they're able to mutate through those suboptimal quantities that are there. But now looking at it from a wash perspective, that also kind of affects the health of our water. Because if you then, if that water then finds itself in your house tap, or it finds itself in a way where you also drink that water, then you'll actually it will actually have implications. And also we can look at it from the aspect of lack of access to some of these wash services, and this is actually also self-explanatory. Lack of good sanitation and all that, it actually leads to spread of infectious diseases and all that. And what it does, it then increases or accelerates the number of people who use antibiotics become big. And as we said, most of the time when we use antibiotics, we don't use them in the correct way. So that gives a very high risk of development of drug-resistant infections. And as we had said, we had also addressed how this also leads to the emergence and spread of AMR, especially because of those residues that are in the water bodies. Then we look at, if we're able to address this SDG, how can we then, if we're able to fully focus on clean water and sanitation, how can we then address this issue? And you find that we have so many foodborne infections that are as a result of poor sanitation and lack of clean water. Issues to do with diarrhea, issues to do with cholera, typhoid, and all that. So if we're able to solve that issue, that means we have actually prevented some of these cases from actually happening. And that means we will not need as many antimicrobials as we need. And that means that if we're able to have that universal access to water, which this goal looks at, then we'll actually reduce a lot of these cases. And then we'll reduce the need to use antibiotics. And that's resistance will also reduce as a trickle-down effect. And that's self-explanatory. And by these images here, just to provide for us at a quick glance of where we are in terms of clean water and sanitation. And it's very painful because for the past 300 years, maybe the world has existed for a very long time. You find that we've actually lost over 85% of the planet wasteland, and we are losing this at a very alarming rate. And another statistic is that, sometimes for at least 3 million people, we consume water blindly. At least 3 billion. We don't know what really contains it. Before that water reaches to us, is not monitored well to know what residues it has and all that. And most of us live in areas where there's a lot of water stress. we have to maybe go miles sometimes, or you have water shortages and rationing and all that. So these are things that actually can be addressed. And maybe in a way, when you're trying to come up with such a project, there's a way that you can actually link it with AMR. Let's look at SDG 8 when you're looking at decent work in economic growth. And how does AMR impede this? And we said when you have a society that is not healthy, then productivity goes down. And when productivity goes down, economic growth goes down. And when growth goes down, then that means that people are not able to live decent lives. And if you have so many people, and this, I just like to take us back to what happened in COVID, where we had people lost so many jobs and all that. And in a way, because of that situation, it became very difficult for a lot of people to sustain themselves. And there was also a lot of, when that was a lot of GDP that was also wiped away as a result. And when you look at issues to do with labor supply, when you have many sick people and you find yourself in such a situation, and that means the labor supply goes down, then that means global economic output also goes down. And people being able to participate productively and to their optimal needs. So someone can actually work, but they're not able to give their best. Issues to do with absenteeism and how it affects systems. Issues to do with food security. Imagine a place whereby you have a lot of people who are dependent upon to produce food, and then they're not able to do so. That means there's a gap in terms of, and there's a very big gap in terms of food security, and also the livelihoods of farmers and all that. Let's look a bit in terms of 12 and 17, and we look at responsible consumption and production. So goal 12 looks at responsible consumption and production. And if I take us back to what the goal says, it says ensure sustainable consumption and production patterns. And Group 17 says strengthen the means of implementation and revitalize global partnership. So we see how does AMR then impact this. And when we are looking at we see that some of these antimicrobial compounds and some of their metabolites or some of the residues, they're actually found in some of these wastewaters. They're actually found in wastewaters, especially which is effluent from manufacturing sites, and for either medicines or some of these companies that now manufacture some of these active pharmaceutical ingredients. And you find because of these effluent, then that means that we are doing production, yes, but we are not doing production responsibly because we are just channeling our effluent elsewhere. And sometimes this is because of maybe we have a gap in terms of regulatory protocols that guide whether how this should happen. Sometimes they exist, but maybe they're not followed optimally because there's no that constant surveillance by some of these regulatory bodies, and maybe organizations also don't have clear protocols, and also self-responsibility that finds this. And that means sometimes that means that we are not able to produce well, and also responsible consumption. Sometimes when we end up purchasing some of these, consuming antibiotics as is not allowed, or any other medicines, then that also affects that. But mostly the issue of production. And if we're able to have good guidelines that guide responsible production, they will guide even steel industries, cotton industries, food industries. But these guidelines on responsible production will also affect pharmaceutical production also, because that's also manufacturing just like any other, and that will be able to reduce a lot of influence, which will also kind of reduce the emergence and spread of AMR in the environment. When you look at issues to do with partnership for goals, you realize that for us to effectively tackle these, we need collaborations, we need partnerships, and this is across different spectrum: the human health, animal health, plant health, environment, and all these levels. So if we are not able to push for these partnerships, then it becomes very hard because we'll end up working in silos. And I think these are others. I'll just start in a nutshell on how AMR actually, in terms of relation with gender equality, you find that AMR sometimes leads to inequalities within societies, and you find that certain groups are particularly vulnerable, especially women, children, migrant refugees, and also people employed in certain sectors. Uh, they're actually more vulnerable because of their living conditions and some of these gendered roles that maybe exist within our societies. And issues to do with industry innovation, I think this one will link up with uh, issues, especially 12. But also something to also notice that if you have a good environment that promotes investment in R&D, then that means you'll have good space for development of vaccines and new antibiotics. And someone can ask, when we say that these drugs are not working, why don't we just develop others? And so there's a whole issue around that, and I think maybe in another session we'll also get to uh, learn more about this. We've already addressed how AMR can actually lead in increasing inequalities when we are looking at some of the issues to do with poverty and how it's actually a loop, and issues to do with sustainable cities. When you have housing that is very crowded, that also leads to when you have poor wash provision and all that, that also leads to a lot of increase in the rate of disease spread and disease occurrence. It used to do with climate action, global warming has also a lot of effect on that, and maybe we can talk more. And actually, global warming is actually there's some some fungi, for example, Candida auris, and so many other bacteria that because of the current the current patterns in terms of climate change is actually leading to a lot of development of resistance. And we've already addressed when you're talking about One Health, how it actually affects life below water. So with that, I bring us to the end of the presentation. And what we'll just like to insist is that when you look at this issue of AMR and SDGs, it's good you look at it from the aspect of holistic in terms of what do we mean by sustainable development. But also, apart from that, we also have to ask ourselves, how does AMR impede attainment of these goals? But also, how does if we're able to push for attainment of these goals, how can it also help in terms of avoiding development of AMR? So it's a two-sided issue. So, and you can look at it from any spectrum. And so with that, I'll just like to leave us with that you should be the change that you want to see in the world. If you want to do change, today we are here courtesy of Randa and the team organizing this, and the fact that there's been able to, they're inspired in terms of giving us this growth, and maybe whatever we've learned today, I would like, maybe let's also cascade it to others who are not able to attend, that at least to be able to be at the front line of change. And so with that, I will invite it to questions if anyone has a question, and then I'll hand it over to Randa. Thank you, and for listening to me. Over.
Thank you so much, Dr. Dania, for your awesome, informative presentation. You have covered a lot of things related to sustainable development goals. Actually, you even enriched my thoughts regarding that. So now we will open the floor for the attendee to share their questions. Who would like to start? Okay, is there any questions for Dr. Daniel? Please go ahead, unmute yourself and go ahead.
Thank you, Dr. Daniel, for this wonderful presentation. Actually, I didn't have a question, but just to thank you because thanks to this presentation, I've been able to understand that actually AMR is closely related to all the SDGs things. So we need really to work together in order to address it. So thank you very much.
Thank you, Christelle, and thank you, everyone, for your warm messages in the chat. I do appreciate, and always a pleasure to also learn from each one of us. Thank you. I think if there's no question as of now, if you have a question, you can always ask in the group. For those of us not in the group, yes, someone.
Okay, so please, can I be heard?
Yes, we can hear you.
Okay, my question is related to the SDG Goal 6. Now, for some time now, water treatment has been an issue, and globally, water treatment plants, they are using chlorine to treat the water. Now, the issue has to do with the chemical, the concentrations of the chemical they use to treat the water. If the concentrations are very low, then we expect to predict risk factors for predict risk factors for most of the antimicrobial resistant bacteria that we know of. So using the One Health approach, how are we going to holistically deal with this issue?
Thank you. Thank you for that, Samuel. Maybe if I understood your question rightly, are you asking maybe how use of chlorine in water treatment kind of contributes to AMR? Maybe you can rephrase, please.
Yes, please. Yes, please.
Okay.
Especially in a very low middle income countries, like some in the West African countries domain.
Okay. Okay. So thank you so much for that question, Samuel. And I'll start saying that you know, there are set standards in terms of, I think, parts per million on what amount of chlorine is supposed to be actually added to drinking water and sometimes wastewater and all that. And as you've rightly said, when you add maybe underdosing and all that, what I see is that if you kind of, because chlorine is a disinfectant, so the reason you add it is to actually eliminate these pathogens. But when you kind of underdose, it could actually contribute to resistance, because then that is suboptimal, sublethal quantities that don't fully keep them, and then they give them this ability to mutate. But also the aspect of sometimes some of this chlorine can also like trigger mutation in terms of maybe gene transfer and all that. So there's a way chlorine also contributes to that. But I understand the issue of the balance. Too little chlorine, you have unsafe water because bacteria survive, and then this other end you have too much chlorine, harmful by you have a lot of then yes, you kill the microbes, but then it means that it's also not very safe for people, and then you'll have a lot of harmful byproducts. So I think what I can say is that there are set standards that exist, and even globally accredited standards in terms of what amount of chlorine should we use. And I think this is also sometimes in most of our countries kind of customized through studies and all that, sharing like where does this balance actually exist. And I feel what we need to do here is actually like adhere to this balance, adhere to the guidelines, and ensure that what is actually stated is what is actually being implemented. And where we feel that there is a challenge, then I think it also creates a room for research for us to ask, okay, this is a set standard that has been given maybe by WHO and all that. But then we are seeing that maybe this is having an effect. So maybe also it's also an opportunity for countries to actually do studies and say the chlorine amount that is actually prescribed, is it quite effective for them? So I don't know whether I have, and also the aspect of maybe in the same also start looking at how can we then develop alternative disinfectants that don't have this challenge. So I don't know whether Samuel have answered your question.
Yes. You've opened our horizon to a lot of comprehensive research to be done in that area in order to curb AMR.
Okay, thank you. Yeah, so I think it's something that needs also a lot of research, so that especially when it needs to be contextualized to attain that balance. Assam, over to you. I can see your hand is up. Assam, do you have a question?
Okay, we can move to Hanadi. Please, Hanadi, go. Okay, Assam, please go ahead.
Okay, I'm Amani. I would thank you so much for this workshop. It was full of good information for us as students in the higher school. And I would thank Dr. Rana for offering us this opportunity and they take this workshop. Thank you so much.
Okay,
Thank
thanks
you
so
so
much.
much. Yeah. I'm sorry, Dr. Daniel. Please go ahead.
No, it's okay. Thanks so much. I can see we have another question from Hanadi. Hanadi, do you have a question? Unmute.
Hello, Dr. Daniel. Thank you for this opportunity. I want not a question, but I want to say that the wars all over the world will bring diseases and pandemic. We didn't we didn't hear about this microbes for today. I think wars it makes a lack of food, lack of water, uh, lack of everything, and lack of health also. Thank you.
Thanks so much, Hanadi, and thanks so much. I think there's somewhere we said about conflicts, and I do agree. Yeah, I think we should. It should be in our small way. Let's also try to advocate for the ending of all these wars in the world, because the implications are also very serious. And even we have not touched on the issues to do with injuries and issues to do with hospital-acquired infections, and especially in trauma settings and all that. So it's really serious, and I think we should all, in our own small way, try to advocate and raise our voices against the wars. Thank you, and maybe we can finalize with Muhammad. Yes, Muhammad.
Hello, sir. Thank you for this very, very impactful and insightful webinar. So I am having like three questions here. The first one is how can public health professionals better collaborate with the veterinarians and environmental scientists to design effective antimicrobial resistance prevention strategies under the One Health framework? And then the second one is it's like a request. Could you share examples of successful One Health interventions that have reduced antimicrobial use or the resistance at the community or on the sub communities? And then what role do behavioral change and community engagement play in addressing the antimicrobial resistance, especially in rural and on the resource settings like here in Nigeria, my country?
Thank you. Thanks so much, Muhammad, for that question. Very well understood. And in terms of public health and veterinarians, that's the first question. I think for us to understand that, I will take us back to the One Health approach. I think the key thing is to understand the holistic issue to do with AMR. AMR is not just a human health issue. It's not just an animal health issue. And so if we're able to see the interlinkages in terms of how that look, because I think I'd shared that how the interconnectedness of how effluent from pharmaceutical companies end up into waters affect fish, how us giving animals or livestock antibiotics for prophylaxis as a substitute to good biosecurity practices, how it's end up, you find that our meat is laced with antibiotics and all that. And also the issue of plants, spraying plants with some of these antimicrobials, and some of these runaway water, how it's end up to the livers, we consume all this. And so I think the major thing to look at is if we're able to identify this interconnectedness, then we can actually say in public health, this is my scope of work. This is veterinarians, this is their scope of work. And if we're able to see that interconnectedness, and that guides us in terms of then collaborating together, where what's your strength, what's my strength, and how do we work together. In terms of One Health innovation, This session is actually co-organized, and one of the key stakeholders who are guiding us today, led by Randa, is One Health Alliance Jordan. And I think this is a good innovation because today we are not just from one country and from one continent. We are interacting, and it's a whole training program. We exchange knowledge and all that from Africa in the Middle East, and led by One Health Alliance Jordan. So, and they are doing a lot of amazing work, which I'm sure Randa will keep on sharing with us. So that's already an example of a very good One Health innovation of the work that they are doing. In terms of behavior change, we see that antimicrobial resistance is a natural phenomenon. But what happens is that human behavior leads to acceleration of antimicrobial resistance. So whether we do, and that's why it's very, you can't eradicate antimicrobial resistance. You can just mitigate it to levels which are not harmful to us, because the same way we innovate as human beings and continue surviving in this continent, it's just the same way that other living organisms continue innovating. So as far as antibiotics exist or antimicrobials exist, and they're always a threat against microbes, they'll always find ways to, for them it's self-protection. For us, we view it as resistance, but for them is they're also looking to survive just as we on our end are also trying to survive. But when we say human acceleration, we look at the issue of behavior change, and behavior change is in terms of what are our health-seeking behaviors. If I fall sick today, do I visit a facility, get a doctor who looks at, me, and if they are not able to do the tests that are required, are they guided by the guidelines that exist in terms of empirical prescribing? Empirical prescribing is whereby you find that different countries have data, surveillance data. So they look at, we tested these against this bug, and this one was the most effective antibiotics. So they develop empirical guidelines, antimicrobial guidelines that say, if you have, for example, meningitis, you can use this drug. If you have pneumonia, you can use this one. And the reason for using that is because we already have some data within our system that actually shows that in the data that this was the most effective one. So even if we are not able to do for you a test, at least what we are giving you is not just blindly, but do we take that initiative to go to the point of, maybe health-seeking behaviors, or, that's the issue of behavior change, and not just from the patient aspect, but also from the healthcare provider aspect. Do I use these guidelines? Do I know that they exist? And not just in human health, but also in animal health. There are also guidelines that guide in terms of how do we treat our animals. Plant health, the same. What are some of the accredited, or what are some of the allowed insecticides that we can use, or parasiticides and all that? So behavior change is everything, because AMR is where it is because of human behavior. And so behavior change is actually a key solution. So one of the key things to look at, even as we look at different innovations, is how can we then, and it's actually an area that we could, maybe those who are interested could also explore more, is how do we initiate this behavior change? How do we make people prioritize more in terms of going to the hospitals? How do we make maybe veterinarians appreciate the need to follow guidelines, and the need to also, and how do we make farmers appreciate the need to invest more so that they have good biosecurity measures rather than using antibiotics? So I hope with that I've answered your question in terms of how behavior change addresses, and I hope I've answered your 3 questions. So I can see we are short of time, but maybe we can hear from Patrick, the last question.
All right. Lovely, Minister. Thank you so much for this lovely presentation on the intersection of antimicrobial resistance and sustainable development goals. My question is this: I read a policy brief on climate health nexus, and I would like to inquire what innovative strategy you would employ in AMR advocacy programs in underserved communities. That is basically explain how climate change, how I can explain how climate change impacts the spread of AMR, and how I can effectively communicate this to individuals in this underserved community. Thank you.
Thank you, Patrick. But I will pose it as a challenge to you that out of what you've learned today, maybe you can also do a bit of research and look at it from that aspect on what we've talked. But just to give you an example, because that also, it also, you know, climate change is also very wide. It also depends at the dynamic that you're looking at. That's why it's, I would maybe hand it over back to you based on the context of climate change that you're looking at. What is this area? But let's just look at it from a simple aspect. Let's say there's a drought in central Kenya or western. I'm just using the country where I come from, and the drought is because one, we've had erratic. We have had it's because of climate change. Maybe we're supposed to be having some rains during this thing, and what that means is that we have low supply of water. What is the effect of this on sanitation? And it means that we have to ration the water that we have because you know, the levels in the rivers are actually down. That means the water that is actually harvested by, you know, the different water companies and all that goes down. So that means that we have to ration for people water. And those are the ones that have piped water. What about for those who don't have access to piped water and they have to buy water? What does it mean that when, you know, when you have to go for miles to actually find water, that means you will have to use that water sparingly, and that has an issue to do with sanitation. Apart from that, what is the effect of this on food security? When you know, you have cows that are very malnourished, you have plants that are not growing, that then leads to an issue in food security. What does that do to our nutrition status? People are not able to eat a good diet, and what does that do to our immune system? Apart from that, let's also look at it from the other aspect of now. So we've had flash floods, or we've had this, what's it called, the, I'm forgetting the name, but let's just use flash floods. We've had flash floods maybe in Lagos and or Amman, Jordan, and you have these floods, and they've actually come and they have swept away. You know, they have this has led to clogging of drainage systems. Some of the drainages which were not, you know, kind of piped. You know, it has been washed away to people's home. What does this mean in terms of foodborne infections, to cholera, to typhoid, and all that? And what does this mean also, you know, when people's housing are really affected and all that? If people, what does it mean, especially for people who live near lakes where, you know, there are these high prevalence of bilharzia? What does this mean in that context? So you'll find that because of this flash flood, there are a lot of implications that actually come as a result of this. So I just hope with those few examples I've explained. But as I said, it depends also on the context that you're looking at. But climate change and AMR is actually very, very prevalent, because if you have a high burden of cholera, that means that not everyone will go to the facility. Some people will actually self-prescribe. What does that then mean in terms of, you know, development of resistance? When you have water from rivers being washed away and it had effluents and it lands into the soil, what does that mean for those microorganisms that are into the soil and they're exposed to these sublethal quantities of antibiotics or antimicrobials? So there's a lot, especially to do with climate change. But apart from that, there's also the issue of a lot in terms of mutations that actually happen because of different reasons also. So I hope we've addressed your question.
Thank you so much,
Patrick?
sir. Yes,
Yes.
sir.
Okay. I don't know, Randa, I can see another hand. You can guide us on the way forward.
Yes, I'm here, dear, and it seems to me that it's an interactive session and a lot of comments, and you are amazing. Maybe we can have another question from Emmanuel. Is that okay with you?
Yeah, it's okay.
Thank you. Emmanuel, please, dear, go ahead.
Yeah, hello. This is a very wonderful session and very, very insightful. And I noticed from most of what you mentioned, it looks like it's a huge challenge. But most of the issues that you highlighted on, it looks like most of it can be rectified with policy directives. But when we come to the lower levels, what can we do at our own levels to be able to curb some of these challenges, to be able to reduce the AMR? And I think there's also another challenge with surveillance records. You know, the glass Atlas and Co, they have like real-time records to show details of what is happening, but I don't think we really have that in Africa. So what are the steps that we can, as individuals, take, perhaps maybe in groups or in batches, if there's a way to, create systems that can keep updating us as to the AMR patterns? And aside policy directives, what can we as individuals with not so much power do at our levels to reduce the AMR issue? Thank you.
Yeah, thank you for that question, Emmanuel. I'll start by saying individuals have a lot of power. And I think we shouldn't view it that action mostly lies at the high level. It starts with myself, self-responsibility. If I decide that I won't be taking antibiotics over the counter, I'll try my very best to prioritize taking them the right way. I'll try my very best to educate those close to me, maybe my family, my friends, my colleagues, about this issue, and they take that step. Here we are almost 100. So each one of us then went ahead and maybe told 10 people, and then those 10 people did the same commitment. We'll almost be 1 million within no time, right? So there's a lot in terms of education that we can do now that we have the knowledge. There's a lot in terms of self-responsibility. There's a lot in terms of advocacy that we can do because some of these policies, as you've said, already exist, but they're not reinforced. No one leads in terms of implementation. Some of them just lie in shelves. So as individuals, the way we advocate for other things, how can we then advocate for some of these things to be reinforced or implemented? So I think that is the way I can address it. But there's also the aspect of innovation also. And I'll use that just as we are, you find that there's a gap in terms of, as you said, surveillance records. You have glass and you find that maybe most of countries, maybe in Africa and Middle East, are not remitting their surveillance data to glass. And you realize that where you come from, there is no data. So maybe do we have any existing data that exists in, that you can access country-wise? And as how then do we take up the role of developing like an innovative platform that can share this? Maybe there's this thing called VIVLI AMR. I think it's usually a competition that looks at how can we use data science and all that, data visualization to kind of put a picture of these surveillance data that we actually have. So where there's a gap, I also believe there's that aspect of innovation and this aspect of enterprise making, and it could actually be a business and all that. So but most important, I think the reason we don't have a lot of surveillance data is also because even in our facilities in most low and middle income countries, we rarely do cultures and sensitivities testing. That means the data available is also very limited because it's just in the high level settings and all that. Yeah. So I think I hope I've answered your question, Emmanuel. And I think maybe for the other questions, we can just continue the discussion in the group. Unfortunately for me, I have to prepare for another meeting after this. But really, thanks so much for the innovative and for the interactive session. Thanks so much for the questions. And thank you so much for sharing your thoughts. Thank you for the web messages. We really do appreciate it. Thank you, Randa and team, for coordinating this. Thank you, and over to you, Randa.
Yeah, thank you so much. We appreciate that. And also we'd like to thank everybody to join us today. See you tomorrow. We have another session with NIMAT, with NIMAT team. Thank you so much for your time, Dr. Daniel, today. We had enjoyed our time with you, especially you have discussed a lot of things related to Sustainable Development Goals. Again, thank you so much, dear. And thank you, everybody. Good night. Thank you. Bye-bye. Thank you, Dr. Daniel. Bye-bye. Thank you, everybody. Awesome team. Thank you. Awesome people.
Thanks, everyone. And let's continue the chat in the WhatsApp if you're there. And in case you're not there, please join. Yeah,
Thank you. Bye-bye.
Everyone, and bye-bye.